We are joined by two gentlemen. Of course, to my left is the Deputy Governor for Kisumu County. Karibu sana to Dr. Mathew Owili. It's very good to have you.
Thank you.
And of course, to the far right, we have Dr. Richard Lesiyampe, who is the CEO for the Jaramogi Oginga Odinga Teaching and Referral Hospital here in Kisumu. Good morning, Dr. Richard. It's very good to have you.
Yeah, good morning. Surrounded
by Daktaris. I love it. We're really by the lakeside. I love it. If it can, your knowledge come in as a JV, that would be wonderful. Gentlemen, before we get into anything else, Janet has a quote that she'll share with you. You can listen to it. Tell us what it says to you, if it says anything, if it speaks something, if you resonate with it, and then, of course, we can get into the conversation.
Absolutely. So today's quote is from a South African political economist who said it actually in Kisumu in 2022. Very short, very simple, but I think it begs a discussion. We are over-consulted and under-implemented. We are over-consulted and under-implemented. Do any of you agree?
Yeah, thank you very much. Yes, I agree. In Kisumu, we have great men and women, very knowledgeable. I think the majority of our doctors probably in Kenya comes from Kisumu or this region. You know, some of the greatest engineers come from this region. I think skilled and competencies are bound in this region. And I think that's why I think that great man said that we have consulted and probably little is done here. Thank you.
Yes. You agree?
Well, I agree. I can't agree more. But first of all, on behalf of the government of the county of Kisumu, allow me to welcome NTV to Kisumu, to Mama Grace Onyango Social Center. Yeah. I am aware that this engagement would be anywhere in the country because we are celebrating the evolution. So we have 47 counties, but you happen to be here. So most welcome, and we are grateful that we can share this day with you. And I mean, going back to that famous short quote, we are talking about implementation and consultation. And I think what this country needs more than ever before is, you know, people or are people who can move and implement, you know, for the sake of the country. There's quite a bit that we just talk about in boardrooms and in offices and everywhere, and probably not very much that we can see on the ground. Yeah. And so for me, the most important thing I can pick from there is that we need to have a country that is more inclined to implementation than, you know, just mere talk.
Consultation and other over-representation.
Yeah.
All right. Thank you, gentlemen. I'll just begin with what has been happening at the Devolution Conference. And this is a question I'm making a point to ask every governor, deputy governor, every county leader, everyone who is, you know, working in any level of the public service, just to see what devolution has done for them and for their counties. And I really want to see the difference in what it does from county to county, because we're all so vastly talented, resourced, all of that. Let me begin with the Deputy Governor, Dr. Mathew. When you think of Kisumu pre-devolution to Kisumu now, what are the biggest wins that devolution has brought?
First of all, you know, without devolution, Janet Mbogo would not be here. You know that.
Janu, were you here? You were here pre-devolution.
I've been talking about devolution. Talking about devolution. She would not be here talking about devolution.
Yeah, okay.
But thinking about the case of Kisumu, and even think about the space where we are at the moment. This is Mama Grace Onyango Social Center. Now, if you look at this space pre-devolution and this space now, the difference is like day and night. Okay, so this is a space where we can have this kind of engagement that we're having today. This is a space where the women of the Kenya actually, and they have met here before, can come and have a discussion about issues that affect them, issues that affect our country. This is a space for the youth where they can come and exploit their talents. Okay, there's a theater group here called Kisumu Art Ensemble. Okay, led by Robert Masera. You saw them rehearsing yesterday. Yeah. So there's quite a bit of, you know, and you know, arts, performing arts, those are devolved functions, culture, and all these kind of things. But going back to the bigger picture, and about Kisumu. And I like saying this many times. Kisumu, of course, is the third largest city in our country. The economy of Kisumu relies upon what we call maritime transport and trade. The port in Kisumu, okay, that was linked to the port of Mombasa and now the port of Lamu, is what gave Kisumu the basis for economic growth. When we were coming into the county in 2017, particularly when Governor Nyong'o was taking over, the port was not existing. The port actually basically collapsed with the collapse of the East African community long time ago in 1978. Now, if you go to that port right now, it is completely refurbished. Okay, we have a shipbuilding yard there. There was, a vessel called MV Uhuru 1 that was not functional by the time we were coming into office. That was refurbished and is now functional and is plying between Kisumu and of course Uganda, the corresponding ports on the other side. We have built another, ship called MV Uhuru 2. Okay, again plying that route. Now, the most important thing about the trade with the port is that we get to decongest our roads. We've had some very bad accidents related to oil tankers in the past, and we know it. So basically, we make our roads safer. Now, the oil jetty that is also in Kisumu, we have an oil jetty here. The pipeline is also in Kisumu. And again, we have had quite a bit of activity where oil barges, okay, those are ships that are, carry oil across, okay, using that jetty. So there's quite a bit of what is going on around the port, okay. And in addition, we are turning Kisumu to face the lake. It has never happened before. Basically, Kisumu is turning her back to the lake, but now we are turning, Kisumu to get to face the lake. So there's quite a bit, that is going on already as a result of devolution in all sectors, okay? And we can go through each one of them one by one. We may not have time.
It's a lot, and I agree. I just have two questions. One, we are at Mama Grace Onyango Social Hall. Who is Mama Grace Onyango? For those of us who may not know, that's number one. And then number two, when we say we're turning Kisumu to face the water, very similar. We had the same thing in
Honorable Wanga said the same.
Yes.
Yeah.
And it was moving a lot of government offices away from the water so that can be now a space for tourism.
Yeah.
What does that look like for Kisumu, and why is it important to do it? But start with Mama Grace.
Mama Grace Onyango, also famously known as Nyabungu, is a very, very famous Kenyan politician and Kenyan leader. She was the first African mayor, as you all know, and the first member of parliament, okay, woman member of parliament, in our country. She died a few years ago, okay, and the governor and the team here decided that we will honor her, immortalize her by naming this center after her. There's so much about Mama Grace that, again, this session alone may not be enough for us to talk about, but those are some of the firsts that she achieved in this country. And so we can say that she's a role model for the Kenyan women, especially those of them who are seeking political leadership. And she proved way those days that what a man can do, a woman can do much, much better.
I like that. So the question of turning Kisumu towards the water, explain what that means and how it's being done.
Well, if you fly above Kisumu, then you will realize that, for example, we have cemeteries around the lake. We have guys who are millers at the lakefront. People are doing all kinds of funny things around the lakefront, okay? But now what we are saying is that we need to plan Kisumu, okay? We need to see, I know that Governor Wanga also talked about Cape Town, okay? But Cape Town is probably the near example that all of us can use. If you go to Cape Town and you look at the kind of investments they have on the lakefront, it's completely different with what we have here. I mean, we still have very bushy, lakefront, that kind of thing. So what you're saying is that in our new plan, we want to, to have a Kisumu that has amphitheaters like what we have in Homa Bay, at the lakefront. We want to have a Kisumu that has an 18-hole golf course along the lakefront. We want to have a Kisumu that has a nice public beach where people can go, take their families and have fun. We want to have a Kisumu that will have nice homes, okay, around the lake. We want to have a Kisumu that has a 5-star hotel, complete with a conference center around the lake, you know, that kind of thing. So that's the kind of thing that we need to see all over, okay? And we want to also see a thriving port. The other thing that we are doing is that, you know, we have, our people basically are fishermen, you know, with the fisher folk, yeah? And they do their, you know, their fishing in the lake, but of course they have what you call fish landing beaches. In the past, we never had, you know, properly constructed fish landing beaches, complete with, you know, spaces where they can park their boats. Right now, Kisumu alone, we've done 5 modern fish landing beaches together with storage facilities and you know, cooling facilities, so that when they get their fish, they don't have to sell it in a hurry, okay? Because if they do that, they don't get what is called you know, a good farm gate price, you know, for their produce. The national government is also doing 2 of those fish landing beaches in each and every riparian county. And riparian counties, we mean the county of Busia, Siaya, Kisumu, Homa Bay, and Migori.
We'll come back and get more of that. It's interesting that we're seeing those synergies between what Homa Bay is envisioning, Kisumu as well. We'll also come back and ask you a little bit about how Kisumu can be the, you know, the region's economic hub and what the plans are for that. But for Dr. Lesiyampe, I just wanted to ask, you know, 2024, 2025 also, we've seen, for example, a cholera outbreak. I think I wanted to ask, because sometimes this is what makes the news, and hear that there's a cholera outbreak and this is affected, Kisumu is affected. What are you doing to stay ahead of the next crisis? And what is it that would help in just ensuring that when there's outbreaks of this nature, there's better preparedness for handling the same?
Yeah, thank you very much. Let me start by saying that Kisumu County in particular has done tremendous work, particularly when it comes to health matters. It happens that I'm the CEO of Jaramogi Teaching and Referral Hospital, which is actually a national referral hospital. But during that period you are mentioning, Jaramogi was indeed under the county government of Kisumu.
And it had not been upgraded to a teaching and referral?
Yes, by then it was under the county government of Kisumu, though it was level 6, but now it's actually under national government. But we in Kisumu played a very, very significant role, you know, in ensuring that we have community health promoters. I think Dr. Owili, I will confirm to you that probably this county was the first one, indeed, even to start, you know, having community health promoters. And what we have done is actually to upscale their competencies and their skills, you know, and their monitoring efforts, particularly when it comes to public issues and public concerns. And therefore, one very critical role that they play is, you know, issues of public health, you know, engaging communities, you know, educating communities, you know, providing them with information, you know, that are related to matters health, and escalating the same from the villages, you know, from the wards, you know, to the sub-counties, and even actually up to the county headquarters. And therefore, what we have done is that we have always been very, very responsive, you know, in actually reacting to this. I think the issues of, I think, cholera, you know, and some of these communicable diseases, I think when it came, I think last time, it's basically because of the seasons. You know, these are the rainy seasons, you know, where we have a lot of rains, you know, and therefore the issue of sanitation, the issue of drainage systems, you know, on these kind of things, you know, create some of these conditions. The only things that there have been very quick interventions, you know, at the county levels, and sometimes when we escalate on the national level. And what we have, that we have got quick response teams, you know, in all areas. For example, in the ambulatory systems, we have in fact an emergency response center, which is actually prepared, you know, for any eventuality. We also have public health teams which are prepared, you know, to handle any situation, including now issues of emergencies, RTAs, road traffic accidents. And therefore, that's how, you know, Kisumu County, and including our hospitals and Jaramogi, in Oginga Odinga Teaching Referrals in particular, are put in, you know, a system. In fact, it's a system, not an ad hoc situation whereby we just rush to it. I think the other very important thing is the issue of preventive. Yes. You know, we have also focused on preventive, you know, and instead of waiting for curative. And the issue of, you know, the county government also taking a strong role, you know, in handling sanitations. I think if you have walked around Kisumu City today, you will see, I think the drainage system being worked on, world class in particular, whereby we're handling the issues of, wastage, sewerage systems, and water systems.
All right. I want you to speak to the fact that now Jaramogi Oginga Odinga Teaching and Referral Hospital was a level 6 but is now under national government. What has changed since then as far as funding is concerned, as far as, anything policy-wise and the trickle down of that money from national governments?
Yeah, thank you very much. I think let me start first of all by thanking the county government of Kisumu for managing Jaramogi Oginga Odinga Teaching and Referral Hospital for all these years, for the benefit of people of Western Kenya, Nyanza, and I think also Uganda and South Sudan. Yeah. Kisumu County has carried the burden of paying salaries, doing the infrastructure of Jaramogi for all these years without any support from national government. And therefore, one great thing that has happened is the fact that the burden of paying salaries to the staff of Jaramogi Odinga Teaching and Referral Hospital will now move to the national government. Two, we have also had staff shortages, which the county government probably could not afford to have all cadres of employees. And now being a national teaching and referral hospital, the government of Kenya now will take the responsibility of looking at the establishment we have and fill in the positions that are, that require, staff. The other very important thing is that we are now going to be getting support, in terms of funding, not only recurrent but also development funds from the national government. Similarly, with the support of national government, we are seeing the possibility of us getting a comprehensive cancer center, a radiotherapy treatment, which is one major gap in this region. Most of our patients, have to go to MTRH in Eldoret, have to go to KNH in Nairobi, for a radiotherapy treatment. And now, with the support of the national government, we are seeing a possibility of getting all those critical equipments that we could not have managed to get, being under the county government of Kisumu.
Is there a timeline on that?
Not really, but I think a time frame between 1 to 3 years, I think some of these major equipments will be in place. But more importantly also, I think at the national stage, we are reducing the burden of patients in MTRH in Eldoret. We also going to reduce the burden of patients in Nairobi or even Nakuru. Yes. Because most of these patients have to go to those facilities and sometimes overburden and even overstretch the resources that those institutions have. And therefore, I think for us in Kisumu and also in this region, we look forward to have the zero-region facility, taking care of all conditions, all disease burdens, at the specialized level, to support the patients of Western Kenya and actually Nyanza as a whole.
Mariam, just before we go into the break, there's something I've noticed the conversations we've had in the last few days, which almost seems like certain services and facilities have scaled over the last 2-3 years. I wonder what the gap has been in the last decade, because a lot of what we're hearing speaks to foreshadowing. For example, Daktari is saying over the next few years, even being able to speak to how policy and services are being, implemented differently now. Yes. But it's been a decade plus of devolution. So just trying to understand where that gap is. But we will come back after this break. Of course, we have Dr. Mathew Owili, Deputy Governor of Kisumu County, Dr. Richard Lesiyampe, CEO, Jaramogi Odinga Teaching and Referral Hospital. You can also ask your questions. Fixing the Nation, one conversation at a time. It's coming up to 7:30. We're back in a moment.
Play it.
Absolutely. Yes. A bit of feedback here. Mukohu Waere is reacting to the deputy governor speaking to wanting Kisumu to face the lake and saying, okay, but the roads to the lakefront hotels are appalling. Strong word there. And public beach in Dunga is unsafe. There isn't a decent place for families to enjoy. He'll react to that, but I believe part of the development strategy is to incorporate all of that. But yes, we are back in conversation with our guests right here at the Kisumu Social Center, Dr. Mathew Owili, the Deputy Governor of Kisumu County, and Dr. Richard Lesiyampe, CEO, Jaramogi Teaching and Referral Hospital. So, Daktari, maybe you can react to that comment of saying, okay, you want to create all of this, but what about creating access, hygiene and sanitation and making sure that it also works for the families that live around that area?
We can face the water, but how do we get there?
I would like to invite him to Kisumu, to see what there is, what exists at this point, and what was before today. But allow me just to say that I like the catchphrase that you have, on this program, Fixing the Nation. And you're saying one conversation at a time.
Yes.
And I want to say that probably to fix the nation, we just need to fix devolution. If we fix devolution, we'll have fixed the nation. Why? Because counties have become the centers of development as we speak. But getting back to my friend and his concern, and he's mentioned Dunga. Dunga then and Dunga now. We're not saying that's the best that we can have, okay? We have a long way to go in terms of turning Kisumu to face the lake. And there's quite a bit of what needs to be fixed, by the way, along that stretch heading to Dunga. But I want to inform him, by the way, not that we're defending ourselves, but the road that heads to Dunga was tarmacked in Governor Nyong'o's administration. It never used to have any tarmac. Yeah, so it was that bad. Yeah. Okay. And if you look at where we used to have fish before, it was called Longni Beach. Then, I'm not sure if Janet got a chance to come there. It was called Longni Beach. Now, if you look at Longni Beach then and what we have in Dunga, it's a complete departure. Okay. So yes, one day at a time, one step at a time, but we are going to get to the level that he expects.
By soon. Yeah. Governor, just before we come back to you, because I really want to know what is that big move that will make, to make this the region's economic hub. Right. What is it that you're doing towards that? But first, unfortunately, there was quite a tragedy that happened, and I just want you to, just want to invite you to take time to share a message.
Yeah. So last week, we had a tragedy in the county of Kisumu. We had a very unfortunate bus accident that claimed 21 people on the spot. And that very evening at our referral facility, that is JOOTRH, we lost another 4. And then later on, we lost another 2. So we're talking about 27 people, all of them related, because they all went for a funeral service and met this tragedy on their way back. On behalf of the governor of the county of Kisumu, on my own behalf, and on behalf of the people of Kisumu, and of course, I think the NTV crew that are here, we condole with the families and friends of those who lost their loved ones, and we pray that God will comfort all of you and keep you strong at this point. But then allow me to quickly add that the spot where this accident occurred is basically a black spot. It is known. I mean, it keeps claiming lives. We are convinced and persuaded that the road needs to be redesigned. And so we want to urge the relevant arm of the national government, and that's the Kenya National Highways Authority, to move with speed. Because if they do not redesign that road, I can assure you, we'll definitely have another accident there.
Deputy Governor, I have to ask, if it is a known black spot, why hasn't county government been pushing Kenya to redesign the road?
We have pushed Kenya to redesign the road. I am aware that the governor has even written a letter to that effect. Yeah. So they should just get up and do their work.
I would say one letter for a black spot may really not be enough. I think because we have lives being lost there consistently, maybe it's for the county government to put pressure, because Kenya's mandate is to do things like this. But of course, if there's, unfortunately, the way things work in this country, if there's no one pushing at it, then they'll move on to the next thing and they'll want to make another highway as opposed to fixing design flaws that are costing lives.
Well, I guess this marks the last push, because we are here on NTV, talking about this at a time like this, and I hope that if they can hear us, please, let's just fix the road.
All right. I still want to come back and know that big move to make Kisumu But before that, Deputy Governor, if it's all right with you, I just want to turn again to Dr. Lesiyampe, and I think about trying to shift and scale the health sector. Across different counties, you'll hear the different reasons why sometimes the trickle-down effect isn't quite met. That's why you have a lot of, disservice, so to speak, to patients. One of them is around procurement, and I just want to understand from you what safeguards or ideas you have in place to make sure that you're keeping procurement clean and free of corruption.
Yeah, thank you very much for that question. Probably before I also answer that, let me also take this opportunity to condole with the people of Nyakach for that loss. And on behalf of my staff at Jaramogi Oginga Odinga Teaching and Referral Hospital, where all those victims were brought we did the best we could under the circumstances, and those we lost after trying our best. And we want to promise the people of Western Kenya that we are going to continue, upscaling our facilities, upscaling our specialties, upscaling, our readiness, so that we provide the best care, in case of such events, and also for anyone seeking for treatment at the Jaramogi Oginga Odinga and Teaching and Referral Hospital. Now, I think the issue of procurement is I think an elephant in Kenya, not even in a room. I think it has been a major challenge in procurement, in not only in hospital environment, but I think in most of our institutions. What I would like to say is that the government of Kenya has put in a law, to try and ensure that procurement is done, overboard, is done, fairly and equitably. However, I think there have been challenges here and there. What I can say is that for us in the health space, what I will say is that in terms of procuring of equipment, particularly in public hospitals, I think it is the right time that we start probably looking at the issues of private-public partnerships, looking at the issues of leasing, looking at issues of placements, because sometimes procuring of these equipments are very, very expensive, some of them go into millions, and I think when we have very, very expensive equipment, that's a time that we have, issues of interest, issues of bribery and issues of this kind. And sometimes also we don't have even the resources, in fact, adequate resources to buy some of these things. But I think through an open system of public-private partnership, an open system of placement of equipment, which I think as we speak now, I think the government has already rolled it. For example, I think National Equipment Support Program, where as we speak now at Jaramogi Oginga Odinga Teaching and Referral Hospital, we have the latest model of CT scan, slice 128, and it's actually on placement, where the private partner actually places the equipment. They also provide all the reagents, all the commodities, and we share. I think the profits, or actually what we can say, the fee. So I think through such a methodology, I think can actually eliminate some of these normal practices in procurement. However, government has also gone ahead now to start what we call government e-procurement. And I think we're in the process of it, effective 1st of July, though it has not taken effect. I think there are a few teething problems here and there that are being sorted out, where all procuring entities and companies will actually be, in a system, and anyone will actually see them, will know them. And there will be a mechanism to ensure that you actually know these are not briefcase, companies. They are really registered companies. They have got an address, and they also have the capabilities, to provide these services or even provide the equipment they are talking about. But I think at the end of the day, the issue is the value proposition and the value management of our country. It's us as Kenyans who should actually be, passionate, should be professional, should feel for our country. Right. Sometimes even if you have a system and, it's what you put in, what comes out. I think it's the issue of having professionals, having people who are committed, people who actually, look for value for money. When they're procuring commodities, procuring medical products, or even procuring any other services. So the point, what I can say is that, yes, it is true, we have a challenge, but we have tried as much as possible, to see to it that we automate some of these processes and these systems. Right. That probably will reduce, I think, corruption and even some of the governance challenges that we experience in procurement.
Just before we go on to the Deputy Governor answering the question on, Kisumu's, potential
might
and might
become.
Yes. I just want to hang on to the healthcare bit for just a little bit. I remember about 2 years ago, a pilot program for drones and zip lines for blood, vaccines, delivery, all of that. How far are we with that? Is that working? Has that been implemented? And I think of that even in light with the accident 6 days ago, because again, blood it's a lifeline. It's a matter of time, and the quicker it can get to those it's intended to, the better. So tell us about that pilot program and whether it, was fully launched and is now being implemented and has been used, or where we are with it.
Well, it's not a pilot anymore.
Okay.
It is an ongoing, concern, a business concern, so to speak. Zipline is an American company, of course, that is in the space of, delivery of supplies and stuff like that. Of course, based in the county of Kisumu, in Muhoroni, but serving the whole of the Lake Region Economic Bloc. And we'll be talking about the Lake Region Economic Bloc shortly when we're talking about Kisumu's, position to be the center of business and trade, within this region. So what has happened is that within their facility, each and every county have their supplies, the ones that they may need to quickly, distribute. You see, for example, vaccines or blood, or if you're in agriculture, antivenoms and stuff like that. So if you are in Kisumu, for example, and somebody needs a particular type of blood, say for example in another part of the county, say for example in Seme, you are better off flying that blood there using the drone than to have somebody drive it there, even if it's in an ambulance. And so all the counties within the local, majority of them, by the way, have their warehouse there, plus those critical items there. So in the event of need, then it's flown, and that way we're able to save lives.
All right. Yeah. Are you able to give figures as to, for example, how often the blood is being flown via drone? How many lives have been saved? Where it has been able to intervene? Where perhaps people were not in a position to get to Jaramogi Oginga and Teaching and Referral Hospital, but they were able to get blood.
I do not have the statistics, but what I can assure you is that, the intervention of Zipline and the drone technology has saved a number of lives, within the county of Kisumu and within the region. I've told you it's not just about Kisumu. It's about CI, it's about Homa Bay and all these kind of things. I do not have the statistics, but they fly out these essential commodities every single day.
Probably I can add at Jaramogi Oginga Odinga Teaching and Referral Hospital, we have also decided to support our blood bank center by having our own in-house blood transfusion unit, where individuals and even our staff donate blood to supplement, particularly during accidents and even times that where the blood center cannot provide us. So I think that's an innovation. And that I think particularly for big facilities, they can have blood transfusion units within their facilities, to store blood in case of emergencies. And this has saved so many lives.
I think so. Maybe now Governor can answer.
Yes.
Yeah, and I can go back to the big question.
Yes.
How Kisumu is positioning herself to be the regional economic hub, in the region. Janet, I did talk earlier about our position and the fact that we are probably the biggest city within the lake basin, if you consider Uganda and Tanzania. So basically we can be the link to East and Central Africa through the lake. You're aware that we have an international airport that is now being improved, to be able to receive, bigger aircrafts. The other thing that we are doing within that space of the airport is that we are building warehouses and again cold rooms that will now allow us now also to start, cargo flights. Of course, I think about 2 years ago we did the first cargo shipment out of Kisumu of green produce. Now the link of Kisumu to the port of Mombasa, when the SGR finally comes, again we'll push it to that level where we can now say we are the economic hub for the region. Kisumu is also going to be home to one of the 5 special economic zones. Land already identified, not yet built. But we are keen on delivering this so that when the wagons come to Kisumu with all the cargo from Mombasa destined for inland or outside the country, they have something to carry away with them. And I want to also let you know that we already have companies that are investing here, like one of them called Keda, that is manufacturing tiles. Quite a bit of what they're manufacturing is basically for export, again through the lake. Now Kisumu is also the headquarter of the Lake Region Economic Bloc. Governor Nyong'o is the chair of that regional economic bloc. We have quite a bit that we implementing together as counties. This zipline drone technology is one of the things that we share, in the counties that are bordering this place. So again, we're talking about a regional economic bloc with 14 to 15,000, million inhabitants. Again, a very big, market, so to speak. So we as a county, creating an enabling environment, for investment to be able to position Kisumu as a regional economic hub now and in the future.
Okay. Yeah. I'm just wondering, because I'm again going back to the Lake Region Economic Bloc, LREB, from both whether it's a healthcare perspective, whether it's a governance and leadership perspective, is there a bigger opportunity here that's been missed in terms of how collaboratively there could be really major wins? I'm trying to think back. I think the only LREB discussion I was a part of, I think a year or two ago, was to do with menstrual health, water, sanitation. And it was interesting to see the economic bloc just sharing learnings and sharing ideas. I also do think it was a case of over consulted and under-implemented, because a lot of what was discussed there hasn't really come to be. So I'm just trying to speak to how can this be like a superpower, because it should be. It's an economic bloc, but I don't know that it has delivered across these various sectors as it should be. So number one, just speaking to why hasn't it achieved sort of like this major big win? I could be wrong, maybe it has. And two, what the opportunities are across both health, governance and leadership.
Yeah. I think thinking about the regional economic bloc and, pushing ourselves towards attainment of, what we all envision, we must think about each sector separately. So the health will have something that they can think about together. Finance. I know by the time you are probably, involved in our discussions, we were talking about a regional bank. Okay, it has not come to happen, but I think the dream is still there. Okay. But the other thing that we talked about together within the Lake Region Economic Bloc, what is called maritime transport and trade, it was one of the pillars of what we thought would be our development. Now, if you look at the development of the port infrastructure in Kisumu, and you look at the port infrastructure in Siaya, and there will be infrastructure in Busia and in Siaya, already earmarked for development, by the way. Some of them county-driven, some of them with the support of the national government. The shipyards are building a ferry for Homa Bay that will ply Homa Bay, Migori, and the other side of the open lake. Then we have secured the commitment of KPA through the presidency to build another ferry, okay, that then will ply Kisumu, Siaya all the way to Busia. So we'll be talking about inter-county trade, okay, that has not existed before, okay, in addition to our trade with outside the country. But that said, we also have noticed that in terms of agriculture, and if you look at the value chain of cotton, okay, most of the counties within the Lake Region Economic Bloc are basically cotton growing counties, okay, and now we are refocusing our energy into that value chain. We are refocusing our energy into the rice value chain. The scheme that we have here, by the way, is bigger than what we have in Mwea, but Mwea still produces more rice than we do combined, okay? And so we are focusing our energy there as well. We are developing the irrigation scheme in Lower Kuja, in Migori County, and of course a Hero Rice scheme. We have invested in a rice milling machine. In the past, by the way, we have had our paddy milled elsewhere and then brought back to the county and the surrounding areas to be sold. And we are saying enough of that. Yeah. So now we have a milling machine. The government is investing in another milling machine, which will be here, another in Kuja, so that we can, quickly uptake what comes from the farms. And I can tell you, it is in various sectors. And again, as you rightly opine here, we are fixing it one day at a time, one project at a time, one value chain at a time. Yeah, we will definitely get there. Sorry,
because of time, I just wanted to quickly, and I'm hoping we can stay for the baraza, because specifically I want to speak to unemployment in Kisumu, which has been statistically larger than the national average. And I know there's going to be some young people in the audience. I would love to speak to them about that. So we'll have that. But I just want to end with, of course, Dr. Richard as well. I'm thinking through how specific counties have targeted specific health goals. Is, for example, I think for Homa Bay, it's maternal mortality, and they're on day 97 now.
Yes.
I think
it goes between 90, 95, 97.
Okay.
Should be 97 if it was 95 a few days ago.
Yes, a few days ago. When you think of not just the issues around Kisumu town and around Jaramogi Oginga Odinga teaching and referral, what do you think is an ideal health goal or a big health win that has been made over the past few years, whether it's reduction, elimination, or prevention?
Okay, thank you very much, Janet and the team. Let me start by also saying that in terms of investment in healthcare, His Excellency Professor Anyang' Nyong'o, the governor of Kisumu, and the management of Kisumu County, have gone ahead even to have an engagement with international organizations to start a pharmaceutical manufacturing company, in this region. And I think that one will go a long, long way, in fact, even to reduce on health costs, and of course create employment, and create job opportunities. One thing that probably people do not know is that Kisumu is actually the center of East Africa geographically. Geographically is the center of East Africa. And I think when the British decided to have the railway, the lunatic railway up to Kisumu, they actually knew that Kisumu was the central of East Africa. And therefore it has an opportunity, to actually get investments across this region. And one very, very important thing that I also like to mention, particularly in the healthcare sector, is the fact that Kisumu can also become a medical tourist center. If we can indeed invest more, in all specialties within this region, and not necessarily for Jaramogi Oginga Teaching and Referral Hospital, but also probably for Kisumu Teaching and Referral Hospital, which is under the county government of Kisumu, that you can have all these specialties, to manage all these conditions, and it will attract, patients all over, and actually become also another opportunity for economic growth for this region.
Right.
Now, I think for the last one is on sickle cell disease.
Yes.
For us, it's actually a major issue, and this sickle cell actually affects only people from Western Kenya and Nyanza. And what the government of Kisumu County has done is actually to allow, Victoria Hospital, which is actually under Kisumu County government, to have a sickle cell center where we are going to have a bone marrow transplant. And indeed, the first steps is actually from 1st of September, where we're going to have red blood cells exchange, between us and the Nairobi West Hospital. Right. And this is actually going to be powerful and great. And therefore, particularly on sickle cell, we want to become the center or the hub, in fact, in Africa, on management of sickle cell disease in this region.
We have to break now, really. But thank you so much for joining us. And I think we'll both be transitioning onto the Baraza, because we've had a lot of wins, but also I'm hearing a lot of future plans, like you spoke to, Jano. So it's good to also know from the people what they feel has worked so far, so that we know where we are at and then where we're going. But thank you so much for joining us. It has been, of course, amazing. We'll be transitioning onto our Baraza live at the Kisumu Social Hall, also known as Mama Grace Onyango, of course, Social Hall. Hashtag is Fixing the Nation NTV. Ask your questions to Deputy Governor Mathew Owili, and of course to Dr. Richard Lesiyampe, who is the CEO of the Jaramogi Oginga Odinga Teaching and Referral Hospital. We'll be right back after this.